Hello, everybody, people who speak English in our channel. Hello, welcome to our direct. In every day we do. Every day we do some direct and some video who is not in direct. Okay. Hello, everybody. I hope you are okay. I don't know who is there because I cannot see here all of you if you are or not there, but I hope you listen well. And our presentation today is about the job position. This is a very important topic. It is a very important topic about job position, postural position, the jaw and posture. Imagine, it's a very interesting topic. We will deal with this today because in dentistry, that is normal. I found the central relationship, but what kind of central relationship? Just here? It's impossible. Huh? To have only there the relationship is very, very impossible. And we will show you today our meaning in our school, all right? Our meaning about central relationship. I hope we are okay in Facebook and LinkedIn and in YouTube. I cannot check it. I am transmitting for a software for streaming, and I hope everybody is listening well. If you want, you can text in the chat here. I'm testing here. Hello, everybody. Yes, if you want to text something there, you can do it. All right, central relationship. The central relationship is something that dentistry is working for many, many, many years ago. A lot of definition, a lot of concept, but all of them are looking only the local position. The jaw is centrated, but everybody, sometime, did you ask if this position is affecting or not the rest of the body? I think no. Dentist never, because for the dentist it's only the jaw position, no more. TMJ's jaw position, this. Some osteopaths, they don't know what is central relationship. Physiotherapists, they don't know, but they know very well. If this jaw is not good, is not in a good position, it will affect the rest of the body. Today I will try to explain how it's affecting. I will try to explain the concept of our school, about it, and we will go ahead to the presentation. We said in our school, we said that it's very important to find the central relationship ever we are looking at. That's why I decided to talk. I decided to talk today about this because in my opinion, is a big confusion all around the world relating the central relationship, and I will explain you why I am thinking that. All right. Okay, go ahead. We call in our school postural centric relationship, not just jaw relationship. The jaw position is centrated in a postural concept. What they mean? They mean that when we are trying to go and find that position, we have to have the body in a good relationship. All right. And going ahead with the presentation. A basic concept and what is postural-central relationship. And then I will show some case treating with that concept in our school in a prosthetic rehabilitation. If you understand that, this is a very interdisciplinary concept. We cannot work only in our teeth. And for that, it's very important to have a basic concept on it. First of all, we have to understand that there is what is the craniofacial system. What is craniofacial system? As the name is saying, it is a system. And how is formatted that system? Not just for TMJ. That's a very wrong concept. We think that we will have only the position of the jaw looking TMJ. TMJ is part of the craniofacial system. It is not an isolated jaw. It's part of the craniofacial system. Remember that, please. And when we are looking in this concept, we know that the craniofacial system, there is a lot of bones, muscles that have to work in harmony. It has to work in harmony. That's very important. Muscle working in harmony. And if we focus on this concept, we change the definition. It's not just a jaw position. It's a neuromuscular situation. A neuromuscular situation is regarding with the body, the whole body. And if we know that, we understand that we have to pay attention in the rest of the body, not to look only here. We cannot look only in this joint or this position. That is a very wrong concept. Imagine that I am saying to you, it's a very wrong concept. And please, I do a lot of presentation about this because it's very important to change that concept. Very, very important. Muscles, structure, the whole body, mind, biochemistry, a lot of things. And then we go to saying what is postural central relationship. What is it? Central relationship of the jaw. The jaw has to be centrated. And we can say that the centric relation of the mandible is where the condyles are centered in the glenoid cavity. But this can only be obtained if the system, the craniofacial system, and its muscles is in balance and also in balance with the rest of the body. But that's important concept, and I'm thinking, because we cannot say only here, or we cannot only look into the occlusion, and we cannot only look into the cranium, but in the rest of the body. And that is a very important question. This is a very important question. Look at not only here, but all the body. We can say, focus on it, that what we can say, centric relation is the position, is a physiological position, is a rest physiological free space of the craniofacial system where the muscles are and relax with the basic tone. Relax it with the basic tone. But to obtain that, we need the whole muscle chain into the basic tone, into the basic neuromuscular action. In our protocol, that means the M.P.R. protocol, myofunctional postural rehabilitation protocol, we call it a neuromuscular balance that cannot be obtained if the rest of the neuromuscular system, the rest of muscle chains, are dysfunctional. For this reason, for us, central relationship should be postural and not only local. That's why we said postural central relations, P.C.R. How to get it? You cannot get it if the system is disturbing the rest of the body. To obtain the good position, you need to first deprogram the system. We need system deprogrammation. Embed the body equilibrium device is a device who do it. If you relax the muscles, the joint, the jaw is going straight away to the central relation. Normalizing muscle change. No more. Nothing more than this. And when we obtain that position, the next step is to have the neuromuscular vertical dimension, and also that is postural. The neuromuscular vertical dimension is the position of the jaw when the muscle chains are in balance and the jaw is centrated with the vertical dimension exactly. And in that position, we can create a good functional occlusion. Functional occlusion, don't forget it. Functional occlusion, not any occlusion. We have to have a functional occlusion. That is the main concept. First, deprogramming, and then reprogramming. The reprogramming is a progressive reprogramming. We will have a progressive reprogramming. Very, very slow, we can get the neuromuscular vertical dimension. And we can do that with the reprogrammer. It's an appliance that slowly go, and with this, we will find the vertical dimension. We do a registration of the free space where when we start the treatment, and slowly we go into the real vertical dimension. As you understand, it's very difficult to obtain that in 1 minute. Just doing open, close. No, this is a little take time to do that and to see if this position is exactly the correct position we have to measure. And we measure in our school with the posturometer. Posturometer is an instrument, an objective instrument based in the concept of Kappanji of body weight distribution. And we can measure and we can observe if with the patient stand up in the posturometer without touching the teeth. And then we say close the teeth again, and we can observe is this occlusion is disturbing or not the situation. That's very important. That is an instrument with a special software, with a special diagnostic protocol that will say to us you are in the right position. And I will show you some clinical case, only one clinical case. This is a patient who has a block in the anterior bite. It's very, very destroyed, the occlusion. And with bruxisms, these patients try to destroy the teeth to make freedom. And then slowly we do, look at that, the bruxisms here, they're destroying the teeth, rehabilitation, and measure. Look at how the body was altered and how it's okay with a good body weight distribution. There is not only teeth, it's teeth and measure. With the posturometer, we can observe if the situation is good or not. And that's very important, in my opinion. This is our application. It's our application of our school. There is the link there, and you have the link in the description of the video also. And I will invite you, this is a little introduction. No? I will invite you next week. If you go to the application, I will put there a free mini course about, that will be free. If you register, you go to the course, and you can see the course in our application. Remember, here is, on the top is here, this is MPR International School Training Center. Is this one? This is my website, but here is the application of the school. This is the courses we do, but that will be for all of you who listen to this video. You will go there, click in the application, register, is free registration. And go. When you register, you can go to this course. You can a little mini course, how to obtain these clinical cases and more explanation about this. That was an introduction. If you listen to the video, go there and you will see how in more details the presentation. I will try now to show you the posturometer in action. Look at that. This is posturometer in action. This is the software, and you will see, look at here, look at. Open mouse and mouse close. Nothing changed. All the colors are the same, kilos are the same, body weight distribution is the same. Nothing is altered. This is a registration. No, this is a software. It's a very interesting software because we can measure also the varicenter, the foot support, the torsion of the body, and all this situation is in the cloud. And if we do here, we play, we can observe how. Look at how the body moves when you are registering the exam. Okay, and then you can observe what happened. There is a protocol, obvious, for this. Okay, remember, if you are looking for a little free course, go and register in our application here, MPR International School Training Central site.eu, and you can have a free course there. They will be on the top, and when you go there, next week I will put that for all of you, for the people who listen to the video. You go there and you can see more about this particular situation that is obviously the central relationship. I will do something free for all of you, all right? And if you like the video, remember, if you think the video is nice, please do a like, and obvious, if you enjoy our channel, subscribe to our channel. It is a free channel with a lot of information. Do a like, click the bell, and the algorithms will share for everybody this information. And you also can share the information for patients, for friends. It's a little channel, our channel, but it's a little community. But you can be part of the community with all the information I will do free for you. And other professionals are doing free information for you regarding the interdisciplinary treatment. Okay, remember, do a like, subscribe, click the bell. Three simple things to help our channel. And remember that. And I will wait for you in the next transmission in our channel. I hope you enjoyed the video. And I have to say now, bye bye until the next presentation in our channel. Bye bye, everybody.